At this point in time, all COVID-19 positive results cannot be tested to see if any variant of concern is present. But epidemiologist Dr. Avery Hinds says there could be additional capacity in the near future to increase samples. His statement came mere hours before the P1 Brazilian variant was detected in 5 additional samples of COVID-19 on Monday. Sunil Lalla reports.
Just last week, Monday, the Health Ministry confirmed that the P1 variant, also known as the Brazilian variant, was found in a local sample following genetic sequencing done by the University of the West Indies. And last Thursday, the same Brazilian variant was detected in 3 additional samples coming from 2 nationals and 1 non-national. Epidemiologist Dr. Avery Hinds could not confirm whether there could be any type of community spread, but says as with any virus, it is possible.
While we cannot yet say that this is an established set of community spread, what we can say is that in the absence of geographic and epidemiologic links, we continue to monitor, but it is entirely possible that once the variant is introduced into the population, then it does what variants do, which is establish itself as one of the circulating strains.
Currently, not all positive samples are being sent for genetic sequencing to see whether the variant exists and is being done via random sampling. But Dr. Hinds says there could be additional capacity soon.
There are discussions in the background to have additional collaboration between Public Health England and the university to see whether additional capacity can be acquired. But at this point in time, with the existing capacity, we cannot test every single positive to identify whether variants of concern apply.
The Health Ministry says the additional cases of the P1 variant do not have any geographic or epidemiological links to the first recorded case, and it's not known where or how they would have picked up the virus.
There hasn't been any difficulty in stating that the variant itself is known to be a South American variant and therefore would be a variant that would have been introduced via that means. We don't know at which point the individuals who have been identified would have gotten their virus because they're both national and non-nationals. Dr.
Hinds says at present, there's no need to test all samples as there are other methodologies and strategies to get the most from limited resources. Sunil Lalla, TTT News.
The Ministry of Health says there are 120 new cases of COVID-19 in Trinidad and Tobago. In its daily clinical update, the ministry says the latest results were from samples taken during the period April 23 to 25 and not the last 24 hours. This brings the total number of active cases to 1,409. The COVID-19 related death stands at 159. To date, 41,549 persons have been vaccinated against the virus. A Form 5 student at St. Benedict's College in Lara, Maine has tested positive for COVID-19. The Ministry of Health confirmed the student's positive test on April 24, according to a release from the Archdiocese of Port of Spain. The student was last on the compound on April 15, and the school was also sanitized on April 16. The Ministry of Health is expected to test the students, starting with those who were in close contact with him. The Archdiocese says the school's principal was informed by the chief medical officer that the child's parent contracted the virus on April 16. The school's office began contact tracing on April 19, and the teachers and students who would have interacted with the student have been advised to self-quarantine.